for joining us today. We're gonna go ahead and get started. That just so you know, we are recording, so just keep that in mind. If you do have questions, just go ahead and drop them in the chat box. I'll be on and just keeping an eye on that, and we'll make sure that your questions get asked. But I'll go ahead and pass it off to Dustin and Kelly.
Hello. Did you say Kelly?
Yeah, we have both Dustin and so Dustin and Kelly. Either of you can start. Whoever wants to go first.
Okay, I can go
Can
first.
you hear me? Okay, go ahead, Dustin. Thanks.
My name is Dustin Dracy. I'm a critical care paramedic. I've been in EMS, the emergency medical services, for about 8 years as a paramedic. Prior to that, I was an EMT for 2 years. And I've worked off and on the last 10 years as a firefighter. So I've worked in the cities of West Des Moines, Clive. I've worked for Unity Point Health in Des Moines. I've worked at Des Moines Area Community College. And currently I am the education coordinator for the paramedics at Mary Greeley Medical Center. So I teach EMT courses. I conduct the department training for our department within the hospital, as well as other departments in the hospital, and some of the first responder groups in the county that we work with. And on good days, I get to still work on the ambulance as an actual paramedic, but those can be few and far between sometimes. So I work for Mary Greeley Medical Center. We're a 220-bed hospital in Ames, Iowa. We have inpatient and outpatient surgical services and numerous specialty services, including cardiology, neurology, pulmonology, and a whole bunch of other ones. We're a city-owned hospital, but self-governed, and we serve about a 13-county area in central Iowa. In my department, within Mary Greeley Medical Center, you'll hear me call it MIX, but that stands for Mobile Intensive Care Services. We're the ambulance department. We're the paramedics in the hospital and for the city of Ames and parts of Story County. So we're a unique service in several regards. One of our claims to fame, I guess, is that we were the first paramedic level ambulance service in the state of Iowa. And we're also the first EMS training center in the state of Iowa. So the first program to conduct EMT and paramedic classes here in Iowa. We're also unique as a training center in that we're the only EMS training center that actually provides 911 ambulance service as well as teaches classes. Our service is the primary ambulance service for the western half of Story County. And we provide backup for the eastern half of Story County and portions of Boone and Hamilton County as well. So that's our department. EMS in general, if you're not familiar, is just healthcare professionals that staff ambulances. There's different levels of that, but primarily I always like to say that we're not ambulance drivers. We get called ambulance drivers a lot, but really we're healthcare professionals. We come to the scene of an emergency. And we provide advanced medical procedures. We give medications, we do advanced medical assessment, and even in some cases, we do minor surgical procedures that are required in an emergency. So if you hear anyone call us ambulance drivers, we're really not ambulance drivers. We're paramedics, EMTs, critical care paramedics in some cases. So we do a lot of advanced medical procedures that can be very life-saving at times. Within EMS, there's a lot of different career paths depending on your level of training. It could be as simple as volunteering for a local ambulance service or first responder group, or serving on a medical response team at your primary job. Or you can make a career out of being EMS, as I've done and many others have done. You can work full-time on an ambulance service, on a helicopter, or even in a hospital service. Our training center and our department here, we see a lot of people that also go on to other healthcare related professions, whether that be nursing, whether that be PA or nurse practitioner, even medical school. We see a lot of our paramedics go on to do that. And then we have a lot of our coworkers that work in the fire service as well. The fire service has a lot of EMS providers. So that's all I got. I guess I'll turn it over to Kelly. Unless there's questions for me. I don't know how we want to do that,
but. Okay, well, I'm Kelly Kane. I'm the director here at Story County Medical. We are a critical access hospital just down the road from Mary Greeley. We are funded by the county, and we do have our own board that makes our decisions and regs and stuff. So that's really nice for us. We do have a lot of the services that the bigger hospitals have, but on a limited capacity. So we do have our clinic that's in-house that we have our providers, both PA and MDs in, and they see patients as outpatient. And then we have an outpatient surgical clinic that is expanding tremendously. Currently, we do some gynaes, we do some pain, we do some kidney stones, little minor things like that. However, we are bringing on 3 new providers, so we're going to be doing more dermatology and joint replacement. So we are heavily recruiting for surgical nurses as we speak. With me, I actually have one of my paramedics here. We also have a mobile intensive care unit with 6 full-time paramedics that work for us. And I'm going to let Doug talk a little bit about what they do and why he does it.
Like you said, my name is Doug, paramedic here at Story County. Been doing this for more years than I care to admit. I do it because I do it because I love it. I didn't start off my career expecting it to be my career, but it became a passion of mine. I've taught over the years in different areas in EMS. Like Dustin was saying, we're not just ambulance drivers. We are medical professionals, but that's okay. See us as ambulance drivers. We do drive once in a while. We are able to provide a lot of different care. Having a hospital-based EMS is a unique opportunity that, you know, Dustin can attest to, that you don't get at a fire-based or a county-based EMS service. You get a lot more experience having that follow through with a patient as you see what happens in the ER after you take care of them in the field. So I think it's a valuable experience for people to get, having that hospital-based EMS, which I think is fairly unique, having 2 hospital-based EMS services this close to each other here in Story County.
I think the other thing too that I'm going to have Doug expand on and Dustin alluded to is that you can make a career out of EMS. So Doug, can you talk about how you first started and then how you ended up getting to be like a paramedic?
How I first started was volunteering in the small town where I lived in. I was a certified GM mechanic and wanted to help out in my community, so I started on a volunteer service. And from that, wanting to help the people I saw more and more, took more training step by step, and it ended up being something that I wanted to do full time. I got onto I took my certification levels up to the point where I became a paramedic, and I was a volunteer paramedic for long enough. Got onto a hospital-based service in northern Iowa and started there full time. So like I said, it wasn't my original career path coming out of high school, but it became that much of a passion for me that that's what I wanted to do. So it can be a career.
The other thing too that Dustin said as a career, we have nurses who may be first responders in their local department and then go to nursing school. That's also a possibility. There's some logistics to that. But again, just know that you're interested in nursing and EMS, you can do that. You can work in the ED, or you can actually run on the ambulance. Any questions?
Well, I don't see any questions in the chat right now, but I have a few that I'd love to ask. Okay, and these are for both of you. So I guess that what are the varying levels of education or training requirement to be a nurse or an EMT?
I'll talk on the nurse first, and then I'll let Dustin and Doug talk on the EMT level. So for nursing, you can get still 2 years and get your RN. DMAC offers programs locally, and there's other programs throughout the state of Iowa. So you can get your RN licensure within 2 years. Hospitals are asking mostly, though, that you do have 4 years or you're working on your bachelor's of science. For me personally, again, this wasn't something that I planned on going as far. I actually have my master's degree in nursing with clinical nursing leadership. I started out years and years ago as a volunteer EMT and have just kind of progressed up through the ranks. So nursing, again, you can do it as little and quickly as 2 years, or as long as you want to invest, depending on where you want to head to your career, or wherever it takes you, I should say. EMS? Doug?
Oh,
So first responder?
yeah, there's everything from first responder to an EMT to paramedic to the critical care paramedic. They have, back in the day when I started it, there was just a few months to get certified. Now it's a 2-year degree. So it is becoming recognized as more as a profession. So that is a good change. We are still certified, but hopefully that will change at some point before too long anyway. So Dustin probably has a better perspective on that as far as I can't think of the words I'm looking for here, but as far as actual sitting down and getting a degree in EMS, yes, it would be a 2-year degree at a minimum, and then there's more on past that if you wanted.
So, I think Doug and Kelly mentioned it, but the 4 levels currently are emergency medical responder, EMT or emergency medical technician,
EMR.
advanced emergency medical technician, and then paramedic. The EMR, the emergency medical responder, that's going to be the lowest one, and that's typically for volunteer squads. We see that in like industrial settings, so a lot of like factory type places will have some of their staff trained to the EMR level to respond to emergencies. And then that EMT level is kind of the entry level for having a career in EMS, or the minimum. That's the level of training that would be required to staff an ambulance. So anytime you're working actually on an ambulance transporting patients, it's going to be at a minimum in EMT service. Advanced EMT just takes that a little bit further. Advanced EMTs can do some simple procedures like start IVs and give some simple meds, and do a little bit more advanced patient assessment. And then the kind of the main level, if you're going to look at a career in EMS, would be paramedic. We can do more advanced assessments. We have a larger scope of practice, so we can do a lot of advanced procedures, put breathing tubes in, start IVs, give a whole variety of medications, in some cases administer blood products. So that's really, if you're looking at a career in EMS, that's kind of the ultimate goal. But the first step would be that EMT level training, which is about a semester long curriculum. I think It takes us 160 hours of classroom time here at Mary Greeley to get certified as an EMT, and that's kind of a national standard. But it takes a few months. We usually model our class around the ISU academic calendar. So it's about like taking a college level 1 semester course just to get your EMT. And like Doug said, from there, the paramedic certification is anywhere from a year to 2 years of training just to get certified. And a lot of colleges and programs are starting to offer that as part of an associate's degree. And I think in the next 10 years or so, we'll see that become the minimum for paramedic training as an associate's degree, maybe. But there are places that offer bachelor's degrees in paramedic studies, but that's not required for certification. So if anyone is interested in this, maybe getting a little bit off the beaten path, but we do have an EMT class coming up at Mary Greeley starting in January. So that would be kind of the first step. I linked to it there in the comments if anyone wants to check that out. But we do EMT training right here in Ames, Story County. So that would be the first step. But all told, about, like Doug said, about 2 years of training and then continuing education constantly.
Awesome. Awesome. Thank you all. So next question comes from Jesse. What goes into determining whether or not paramedics should transfer a patient from one smaller hospital to a larger one?
So there's a couple, I guess, ways you could think about that. You could think about that from like the scene of an emergency. And really that kind of comes down to provider judgment or written protocols. A lot of what we do is written down in a protocol format by a physician, medical director. Everything we do is overseen by a physician to some degree because they are the kind of the endpoint for medical care. So from the scene of an emergency, a lot of that is provider judgment, experience, and then just what your protocol says. It's, I suppose, more complicated if you're talking from a smaller hospital, like Mary Greeley going to Methodist or the University of Iowa. That is ultimately up to the physician who's providing care at the time for that patient, determining, where they need their definitive care and how they're going to get there. Do you guys have anything to add?
Yeah, like you were saying, it's ultimately comes down to it. Like you said, if it's the patient's already in the hospital, it's ultimately the physician that's going to decide where that patient or why that patient's being transferred. But if it's in the field, it's dependent on the condition of the patient, what they need, and what the hospitals are able to provide. Having your level of care that your hospital can provide, and it's like you're saying, our written protocols, our experience and judgment, and with the level, like I said, the level of care that the hospitals are able to provide, or the services that are available at that hospital. If we have somebody that we're seeing needs, say, a cath lab and a cardiac care that is not available at Story County, well, we know that we need to go beyond that, and we'll call, like, say, Mary Greeley and see if they have that service available at that time, or if we need to go on to Des Moines or wherever to provide the best appropriate care for the patient. So it ultimately comes down to the closest appropriate facility for the patient's needs.
So Story County is just a level 4 being critical care access. So there's very limited when it comes to trauma. So most of our patients that are trauma, we have to ship out. We do have a helipad here at our hospital, which is unique. So we can have the helicopters come in here. So for instance, if we're tearing with another unit or department, they can bring the patient here, and they can also be picked up through, and transported through the air transport emergency. which we are proud of since we are a level 4 and limited. As Doug and Dustin were both saying, again, there is some providers say definitely, there's some patient say in where they want to go, but it ultimately does come down to what is best for the patient.
Wonderful, thank you. Next question, are there any volunteer opportunities for high school students to get involved in this field?
At your local level, I think you have to be 18 to take an EMT class, but once that class is taken, I know a lot of them will allow, you can do a ride along to see if it's something that you're interested in even further, but take a CPR class, get certified in CPR, become a driver, as long as you have a good driving record. But you have to be 18 to take a class, I believe, and once you have that certification, you can volunteer. So if you have a first responder group in your town, and most towns are pretty desperate for first responders, so they need all the help they can get.
So it actually is 17 now. They changed the code like last month, so that changed.
They are desperate for
very
help.
recently. Yeah, very recently changed. Doug mentioned the first responder groups. Every small town has a volunteer first responder group. They might even pay you per call. I'd say at a minimum, they would want you to have BLS for healthcare CPR, which is a pretty easy course to get. And they would put you through that if you wanted to volunteer. At Mary Greeley, we actually staff all the football games at Iowa State and a lot of the basketball and other sporting events. So I don't know with COVID if we're currently taking volunteers for that, but in the past we have had people come and volunteer with us at the football games. It's kind of a fun opportunity to be involved. So if you do want to volunteer at football games, you can shoot me an email and I'll get you in touch with the right people. And my email is going to be on that webpage too, but I'll put it in the chat. So football games with MGMC would be an opportunity to get involved at a volunteer capacity. And job shadowing at the hospitals. I know Mary Greeley, again with COVID, I don't know what we're currently doing, but under normal circumstances, we allow job shadows in all the units and in the ambulance as well.
Story County Medical's allowing job shadows. We do that through our HR department. We got a form that we go through. We do provide PPE, but yeah, we're allowing job shadowing.
Wonderful, thank you all. So what is your favorite or most stressful story or experience you have on the job?
Way to put it on the spot. There's a lot of them. Boy, I don't know.
I think anytime that you're talking about EMS, whether you're a nurse in the ED or you're that paramedic or EMT, or even the first responder, when you're responding and trying to help someone that is in a critical situation, life-threatening most of the time, it's stressful every time.
I can tell you the worst that turned into the best was when I delivered a baby. So that was in the back of the ambulance. It was the most stressful to the best feeling ever. So there, both in one shot.
Yeah, I would echo that. Delivering babies in the field is really, really scary, but then it's usually a happy outcome, whereas a lot of our calls aren't super happy. I guess my favorite, like Doug said, there's a lot of them, but my favorite experience is just anytime I get to really utilize all of my training and use advanced procedures and really care for a sick patient and see like how that care helped them, which isn't like real often. I mean, all our calls are emergencies, but they're not all really involved medical emergencies from our standpoint. But those calls where we do get to use a lot of our skills that are less frequently utilized are really exciting. And then just on like a routine level, anytime, because it's always an emergency for the people that call for us and want our help. But we do it every day, so we might not always, we get a little jaded and don't always perceive it as an emergency. So if we can turn that into a good thing and, really calm our patients and help them, bring them comfort and, in their emergency and help them feel better about their situation, that always makes me happy and like brings me joy in my profession, I guess.
Awesome. Those are some great stories. So back to job shadowing. How old do you need to be to job shadow at either Story County Medical or Mary Greeley?
I do not know.
I want to say 7.
I would think 17 at least, maybe 18. I can look into it. For Mary Greeley anyway.
I have to get back to you.
Perfect. So what, oh my gosh, sorry, I was really tongue tied for a second. What is some advice you have for students who are interested in this field?
I would say do some of the ride-alongs and do a job shadow and see if this is something that you think you want to do, because I tell everybody it's hours and hours of boredom surrounded by minutes of panic. Being in the hospital is a little bit different. I've done both hospital and like independent county-based services. The hospital is a little bit better because we can help out in different areas of the hospital and stay busy. But you're not always on the go. You're not always, so you got to keep yourself busy. Sorry. But you also got to kind of balance that and be ready to go at other times. And then when you are busy, you're super busy. And so it's hours and hours of sheer boredom surrounded by moments of sheer panic.
I would echo Doug again, volunteer for your local first responder service, maybe take a CPR class or a stop the bleed class, and see if it's something you are really interested in pursuing. And if you are, even if you're just thinking medicine in general, whether you want to be a PA or a physician or a nurse or a paramedic or whatever, if you're really set on that, committed to that, maybe take an EMT class. So it's not something you don't want to experiment in medicine or EMS by taking the class, because it's not an easy class. It's like taking a college class. So it's not really a good opportunity to just test it out. But if it is something you're really interested in and you've done that volunteer or worked on a rescue squad or something like that, then definitely look into taking an EMT class somewhere or an EMR class as well.
Awesome, thank you. Okay, so what is the job outlook in your field?
EMS is definitely a growing profession. It's up and down with the economy, whether lots of people are hiring or not. We're currently hiring at Mary Greeley for paramedics anyway. So it just kind of depends on your locale, but generally it's a growing profession and there'll be a lot of job growth in the next several years.
I would have to agree that it is growing. There's becoming more and more of a demand for pre-hospital care, and there's always going to be a need. People are always going to be sick.
Great. Well, that's the last question I have. Do y'all have any last words of wisdom you'd like to share?
just know that if you're going to go into nursing, medicine, EMS of any sort, that the schooling is grueling and the time on the job is many hours. But the satisfaction knowing what you're doing for not only individuals, but your community, to me is extremely satisfying.
I would agree with that. And your motivation has to be, I think, personally, to help people and to do, like Kelly said, something for your community or your patients. It is exciting at times, but that's not going to keep you going when you're doing this for even 5 years. You know, that the excitement kind of wears off. You get used to that. So you got to be there to help people, and I guess for the right reasons, right motivations.
It takes the commitment and the desire to keep doing it, because you'll work nights, you'll work weekends, you'll work holidays, and you'll spend time away from family and friends. And so if you're not in it for the right reason, you won't be in it long. So take the job shadow, take the ride-alongs, find out if this is something you want to do.
Well, wonderful. Well, thank you all for your time today. I know I appreciate it, and I'm sure our students appreciate it as well. Thanks again for joining us.